Well, thank you very much. This is truly an honor. It is my pleasure to join you all at the Icahn School of Medicine at Mount Sinai to congratulate the graduating class of 2022. This is a very special occasion in your lives, and I am truly honored to be speaking with you this afternoon, and I am truly honored to receive this honorary degree, so it's a special occasion for me as well. I spent 10 very, very important formative years of my career at Mount Sinai, and so it feels very fitting to accept an honorary degree from the institution that in many ways shaped my career. My years here were truly unforgettable, and it's an honor to officially join your ranks as an alumni of the Icahn School of Medicine at Mount Sinai. To all of today's graduates, congratulations on taking this important step in your lives. You made a wise decision in coming here, and I'm sure you received an outstanding education. COVID-19 tested many of your skills early on, especially one skill you will always need, which is adaptability. The pandemic thrust the importance of medicine and public health into the spotlight. I feel that there are some important lessons of the pandemic. One is that we are truly all interconnected. The decisions that each one of us make influence not only your own health, but the health of your family, our communities, our nation, and literally the world. Another important lesson is the importance of medicine and public health. Medicine and public health have been so important. They have been in the spotlight. Truly, medicine and public health right now and the medical sciences are the center of the universe. I used to think it was Brooklyn that was the center of the universe, but no, it's medicine and public health. Other important lessons are the COVID-19 showed us the depth and breadth of the health disparities that exist in our nation and the importance of health equity, which is really central to everything that we're trying to do at Health and Human Services. And finally, the importance not only of physical health, but mental health. I think one of the lessons for us all is to remember the importance of mental health not only for our patients, but also for our families and actually for ourselves. Realize when you need a break and when you're giving too much of yourself. And you can only help others if you are healthy too. Your time here has given you knowledge and the application of that knowledge, and that will be very useful in terms of all of the essential skills that you have learned and you will continue to learn. But you have received other lessons here as well. You have learned the need for compassion and sensitivity, for empathy and concern for your patients, but also for your family and your friends, for your colleagues and yourself. You have learned the need to be calm and confident and the ability to innovate and expect the unexpected. So many people here have been giving you quotes. I'll give you a very important quote. It is from Douglas Adams, who wrote The Hitchhiker's Guide to the Galaxy in the 1970s. It's a little dated. In fact, it's pretty old, but I thought it'd be a useful quote anyway. The quote is, "I may not have gone where I intended to go, but I think I ended up where I intended to be." So that's an interesting saying, and it brings to mind a few examples from my own life and career. I went to Harvard College, as was mentioned. I went to the Tulane School of Medicine, and I never thought that I would be the Assistant Secretary for Health and a 4-star Admiral leading the United States Public Health Service Commission Corps. Like you, many of you, I was concentrating on learning the basics of medicine, how to diagnose and treat illnesses, and I was soon drawn to pediatrics and to adolescent medicine. But every experience that you have, every experience, whether big or small, adds very valuable life lessons. Following medical school, I came here to Mount Sinai for my training in pediatrics and adolescent medicine and stayed as faculty for 5 years. And I was confident that I could tackle the small task of eliminating all the ailments of the children and youth in New York City. Not that I was idealistic in any way. I realized it would take more than a year or two. It might take all 5 years of my training and needing time as a faculty to do that. So I guess it's important to have patience and to set realistic goals. So I might not have eliminated all the ailments of children in New York, even as a resident and a fellow or as a faculty member. But I truly did make a difference for the individual children and teenagers and families that I saw. So on days that you might get frustrated with our medical system and our public health system, whether as a physician, a scientist, or both, or whatever path you take, please remember the ways in which your work improves people's lives and can literally save people's lives in so many different ways. A significant lesson I learned in my training at Mount Sinai was the importance of teamwork. In the clinic and in the hospital, we had to work as a team to take care of the complex cases and children that we saw, patients with very difficult circumstances. So collaboration and communication are far more valuable than competition. I've been thinking a lot about my year as chief resident of pediatrics at Mount Sinai, and to be honest with you, it reminds me a lot of the last year or two during the COVID-19 pandemic, but some of the most challenging years of my life. And leading Pennsylvania through the pandemic in 2020, and then working to lead with many others the United States through the pandemic in 2021. I think that very challenging years, and I think finally now, as the Assistant Secretary for Health, I have as much authority and responsibility that I had as Chief Resident of Mount Sinai in 1986-87, or at least I thought I had. In 1993, I left New York, and I actually went to the Penn State College of Medicine and the Hershey Medical Center. So literally, I moved from 80th and 1st in Manhattan to rural central Pennsylvania. I really think that that is actually the biggest transition that I've ever made in my life, and that is saying something because I've had some significant transitions. At Penn State, I started and ran the adolescent medicine program. I started an eating disorder program. You know, in Hershey, Pennsylvania, you truly can smell the chocolate, so I thought it was a perfect place for the eating disorder program. But I had another big transformation coming. So as you know, and I'm an openly transgender woman. I transitioned more than a decade ago. Penn State Hershey had a fantastic Office of Diversity. They had a non-discrimination policy that included sexual orientation, but also gender identity and expression. And I was not accepted there, not just accepted, I was truly welcomed for the diversity that I brought the medical center and the College of Medicine. And I strongly feel that diversity, equity, and inclusion, in all of their myriad and wonderful aspects, and the beautiful tapestry that we have of diversity in the United States, should be truly welcomed and celebrated for the way that it strengthens and enhances any organization. And then my life took another turn. I was minding my business, well ensconced in academic medicine, fulfilling all of my missions, seeing my patients, running my program, when I got a phone call asking me to co-chair the Transitions Committee for Health for Governor-elect Wolf in Pennsylvania. I agreed to be the co-chair, but I said, I'm not giving up my day job. My whole life has been in academic medicine. But I did become intrigued by the work we were doing in public health and population health, and then one thing led to another, and I became the Physician General of Pennsylvania and the Secretary of Health of Pennsylvania. Now, once COVID-19 hit, that became my most urgent and primary focus. I am a positive and optimistic person, and I believe that when we work together, we can use those lessons of the pandemic that I mentioned to make better systems, better medical and public health systems moving forward. We can improve our approach to everything from mental health to substance use and overdoses, including health equity, climate change, the health impacts of climate change, and more. But then again, another change. In January 21, about 10 p.m. in January, I received a text from the Biden administration asking if I'd be interested in a job. Didn't sleep much that night. I spoke with the transition team early that morning, and they asked me if I would be interested in the position of the Assistant Secretary for Health. And I went, well, yeah, I would, absolutely. And now I stand before you in that position, a position I never imagined I would hold, but truly the honor of my lifetime. I wake up every day with a mission of helping people, and really always have. And this role lets me help people across our nation by working on health policy. Among my duties, I am the head of the United States Public Health Service Commission Corps, America's health responders. Our public health service officers are the first in line to defend our nation's public health against threats small and large. Our medical, health, and engineering professionals fight disease, they conduct research, and they care for patients in underserved communities across our nation and actually throughout the world. For those of you who are still deciding on a career path, I encourage you to learn more about this amazing group of medical and public health professionals, uniformed doctors and nurses who protect our nation's health. We also have a ready reserve, sort of like the National Guard, where you can be in your field of choice, and then you can also, when our country needs you, put on the uniform and deploy to serve our nation. So in conclusion, my recommendation is to plan big, have big goals for your career. Know that life may take you on many different turns and send you on unexpected paths. But I am confident that your education here at Mount Sinai will prepare you for all of the expected and unexpected roads that you will travel. And please keep your idealism. I'm sure it'll be shaped and tested by your life experiences, but please don't lose your idealism. So I offer my enthusiastic congratulations to today's graduates of the Icahn School of Medicine at Mount Sinai. The education that you each have received during your time here, both in and outside of the classroom, have prepared you well for personal and professional success. Like others here, I ask every graduate to use your excellent education to work towards the common good. With hard work and intense focus, your class will usher in a brighter future for our country and the world. So congratulations, you are starting on a remarkable journey, and I have complete faith and confidence in you. Thank you.